So the one thing that I've been working on is that oftentimes we have noted with our under 5 children that despite being vaccinated against certain diseases, they're still falling prey to these diseases that we're vaccinating them against. And we always try as scientists to look into the reason behind that and why is it that we're seeing those results. So in my work, we've been looking at why the Rotavirus vaccine, which is given to children at 6 and 10 weeks to prevent severe diarrhea, is not working in some infants. Why are they still coming back with diarrhea to the clinic? So one of the proposed reasons has been actually that the mother's breast milk has been interfering at the time of vaccination. So what has been proposed is that when a child is vaccinated, Rotavirus is a live virus. So when the child is vaccinated, it's been proposed that when the mother breastfeeds the child, the antibodies in the mother's breast milk actually clears off the virus so that that child never has a chance to respond to the vaccine. So in my work, I've been trying to mimic this in the lab setting and see how exactly this happens. So what I've been doing is using cell culture. I have a set of cells referred to as MA104 cells, which are basically supposed to mimic the stomach. And in there, what I've done is that we have added virus. So this would imitate the vaccination stage of the child. And what we're doing is that once we add the virus, I also add breast milk to this sample. So breast milk now would have all the mother's antibody and reagents. So in the lab, we have tried to mimic all of this. And what we have seen is that there is some interference because ideally, when the virus is in the cells, it should be able to replicate and produce more of its cells. But what I noticed was that there was a much lesser amount of virus in the cells when you added the breast milk. So basically, this is showing that we are seeing some sort of interference from the mother's breast milk. So one may argue that if the mother's breast milk is interfering, mother shouldn't breastfeed. That is not necessarily what we're trying to say here. What we're trying to say is now how can we overcome this interference that we're seeing? So some of the proposed methods are that one, we can try and vaccinate these children much earlier before the mothers have a lot more antibodies in their breast milk. Or we can consider vaccinating them much later when the mother's breast milk is not so much a big factor, or maybe the children are now moving on to solids. Others are saying maybe we need to move to injectables because injectables do not have the same interference that we're getting in the oral vaccines. And we've seen this with polio, and maybe we should actually consider doing the same thing now with the rotavirus vaccines.